Thank you. Please share. You can share the slides now. So good evening, all of you. Welcome to 176th edition of Thursday Musings. We are back after ANSIPS. Today we have a very interesting lecture. Part of it, there will be live demo also. So we are looking forward to it. Next slide, please. I'm handing over the session to Professor Dr. Tufan Pati sir, who is from Cuttack and chairman of this program. Sir, I'm not reading your slide and you can return the favor to us. Over to you. Please unmute yourself.
Thank you, Alim. And I want read your CV. Next slide, please. Our moderators, Dr. Amrit Patjoshi and Alim Siddiqui, are well known, and they are still more known, for which I congratulate them on this platform of Thursday Musing for having done the elections in IPS and during the ANSIP cell in Kochi. Congratulations from the very core of my heart.
Thank you, sir. Thank you.
Thank you.
I would like to share with everyone that Dr. Lalit Batra, a good friend of mine, who is the superintendent and professor in SMS Medical College, had been the past president and secretary of IPS North Zone, author of several books. Is not joining now. Maybe he will join in between. This introduction is for this. And I am having a very bad throat. I will request Dr. Limer to introduce Dr. Shah. And Dr. Shah will introduce the topic as well as the speaker. With this, may I mute myself?
Next slide, please. So our other chairperson is Dr. Raghav Shah. He is from Jaipur. He is DM in Addiction Psychiatry from PGI Chandigarh and postgraduate from SMS Medical College, Jaipur. Currently, he is consultant psychiatrist and addiction treatment specialist. He is director of Center for Addiction Recovery, Rajasthan Hospital, Jaipur. He has several publications in national, international journals, organizing secretary to Addicon 2023, and is IMA Central Working Committee member, rather was from 2015 to 16. So the show is now over to you, Dr. Raghav. You can introduce, say a few words about the topic, and then Dr. Shahul will take over. Dr. Raghav, over to you, please. Please unmute yourself, sir.
Yeah. Thank you so much, Alim sir. It's my pleasure and a privilege to be part of this group. And the topic is a very interesting one, especially from the practical aspects. And we have a wonderful speaker in Dr. Shahul Amin, who is very well known. I would give only very few things about him because people know him very well. He's currently a consultant psychiatrist at Thomas Hospital, Changancherry, Kerala. Editor of Indian Journal of Psychological Medicine, if I'm right, since 2017. He's also co-editor of the book A Primer of Research, Publication and Presentation, and has written multiple articles in Malayali periodicals, many publications, and has written the ebook A Companion to Fish's Psychopathology. And he has been awarded the Certificate of Excellence for Best Case Presentation at the annual ANSIPS annual National Conference of Private Psychiatry Association in 2013. And we all know him very well. And I personally also look forward to listen him on this topic. Now coming to the topic is about acceptance and commitment therapy for addiction. So acceptance and commitment therapy is a part of the third wave therapies. This is not specific to addiction only and has been utilized in many mental disorders for well-being of our patients. The acceptance approach to addictions basically focuses on psychological flexibility. So very simply speaking, acceptance of the problems a person is facing, the cravings he is having, the every problem that he has in his life, and then working on it with the psychological flexibility, and then taking the step of change, that is commitment to change. This approach draws heavily from mindfulness, wherein we are more of an observer of our mental processes as well as the things going around us. And rather than simply reacting to it, we choose how to respond to them. In the practical aspect, many a times when we treat persons with addiction or addictive disorders, a common problem encountered is relapses. And many a times the family members report it in a commonsensical way that till something is preventing this guy from relapsing into his habit or continuing his habit, be it medicines, be it a restricted environment like a rehab, or be it some kind of external pressure that there is some restriction in the job or there is some exam or something, he relapses back to his habits. So, where is the internal change in the person so that we can rely on him where everything is in place? Nobody is there to see him. He has the money or resources to get his addictive substance, and he's pretty much sure that he won't be in a simple way caught while doing it. So, where is that point that we can trust that person with this recovery, that he is in that stage of recovery that he won't relapse in such a setting? So this internal change or a change from within, wherein a person grows out of his addiction, uh, in my personal opinion as well, I believe that the mindfulness approach and the acceptance and commitment therapy drawing out of it uh, can have significant benefit, because recovery which can be sustained for a long period of time can be the utopian target for addiction treatment. And this is actually what most caregivers and the public in general expects from us. Although the stages in between, like harm reduction or benefit in some spheres of the complications that have arisen out of addiction, and maybe not that much benefit in others, can be a clinically significant improvement. But the overall goal is for an internal change. And that's where I believe this therapy is also one of those approaches which can have a significant impact. So now I would hand over to Shahul Amin sir so that he can explain and share his experiences and enlighten our audience about acceptance and commitment therapy for addiction treatment. Thank you.
I hope my slides are visible in full screen. Thanks organizers for the opportunity, and thanks Dr. Raghav for the introduction and also very succinctly introducing the topic and its relevance. So I will be sharing the slides and also some files related to this, like some audio demonstrations and some articles and all. So I will share the link in the chat box at the end of the presentation. So as Dr. Raghav said about the development of acceptance commitment therapy, very briefly about the historical aspects. First, we had the first wave of psychotherapies, the psychodynamic psychotherapy and all. Then we had a second wave, including CBT and all. As he said, this is a third wave therapy, acceptance and commitment therapy. The reason for the development of ACT, not only for addiction, it was not primarily for addiction, it was for depression, anxiety and all. But the major reason for its development was that, like initially in the 70s and 80s, researchers found that the CBT techniques, which were very widely used in those period, lacked empirical support. When they tested it empirically, the results were not that great. So, like the concept of acceptance, as Dr. Raghav said, was introduced. What acceptance means in the ACT perspective, in a very simple terms, is that acceptance means allowing our inner thoughts and feelings to occur without trying to change or ignore them, even if they are unpleasant or painful. So here there are some key words here. For example, like we are allowing our inner thoughts and feelings to occur without trying to change or ignore them. If you compare with, say, CBT for depression, what we do is we try to change negative thoughts into positive thoughts, right? I am good for nothing. I have nobody. I am lonely. These kind of thoughts we try to help the patient challenge them, and we help them find some alternative thoughts to counter these negative thoughts. That is what we do. When we are doing CBT for OCD, we teach the person to train the person to ignore the obsessions, not to pay a lot of attention to the obsessions. So this is how especially the CBT works. While here we are not asking the person to change or ignore such inner thoughts or feelings, be it thought in a depressive cognition, be it a feeling like a craving or anxiety. Even if these inner phenomena are unpleasant or painful, the person has to accept that. That is the core of the concept of acceptance. These are the people who initially introduced this concept of ACT, Hayes et al. This is the Bible. It is in its second edition now. So what they told was that, compared to especially CBT, an effective approach for be it mood and anxiety disorders, be it addictions, they should also include acceptance and mindfulness strategies so that the persons can make meaningful changes. We will see what these meaningful changes are later, especially when we discuss the concept, the second important concept in ACT, that is values. So as Dr. Raghav said, when we are using acceptance, when we are using the concept of mindfulness, how that helps is that help the person develop psychological flexibility, which is very important, especially when one has to deal with cravings in the context of addiction, or be it depression or anxiety and all. So what is psychological flexibility? Again, in simplest terms, what it means is the ability to do whatever one chooses to do, whenever one chooses to do it, without being limited in one's choices by what is going on inside one's head. So you have determined to do one thing. You are interested in, say, football or cricket. You are interested in developing friendships. So you can do that. You can engage in such activities even if you are what is going on inside your head is not conducive to that. You are feeling depressed, you are feeling anxious, or in the context of addiction, you are feeling an intense craving and all. Despite the presence of such negative internal phenomena, you can choose to do what you want to do. That is psychological flexibility, as the illustration also shows. Because what is the importance of psychological flexibility? Why it is that relevant? If you are to suppress thoughts and emotions, it may not work in the long term. Like usually what we do is when we tell the patients when they have a craving, we will come to that later also. We will ask them to use some distraction strategies and all, some avoidance strategies and all. They may help in the short run, but in the long term, they may not be that effective, because that leads to a lot of wasted unproductive time. That needs a lot of effort from the patient and all. So suppressing, be it craving, be it low mood, be it obsession, it is not going to be very useful, very practical in the long run. So one has to, a better alternative is to accept them, to learn to live with these negative internal phenomena. That is what acceptance means, psychological flexibility means. So the point of ACT is not to feel better, but to better feel. That is a very concise summary of what ACT does. The aim is not to feel better, in the sense that it is not to get rid of the craving, to get rid of the depression, get rid of the anxiety, and to feel happy, content, elated every time. But to better feel, whatever you are feeling, feel that in a better, productive manner. That is the basic concept, basic message behind the principles of ACT. So what we do in ACT? There are two terms, acceptance and commitment. What both these terms mean? When we are doing ACT, the patient has to accept things out of one's control. In the context of addiction, what that means is, suppose cravings. Cravings are, all of you know, that the brain are products of the brain. They have a biological basis. And cravings are bound to happen once the person has addiction, because of the neuroplasticity that has happened in the person's brain. The person is bound to get craving, be it spontaneous, be it triggered by some conditioning, by some associations like seeing a drinking buddy, or seeing a bar, or even listening to a song that the person used to listen to when he was drinking or smoking and all. So cravings will happen. These are things out of one's control. So this the patient has to accept. You cannot escape craving. At the same time, the second principle of ACT is commit to change what things one can change. In the context of addiction, that means though cravings one has to accept, cravings one cannot suppress, one cannot eradicate, but one can choose to change the way one reacts to the cravings. When you are getting a craving, whether you go and drink or go and smoke or go and play PUBG or whatever, such behaviors you can change, you can commit to change them. That is the basic essence of ACT. So there are three things that one does when the three stages in which one tackled an episode of craving in the context of ACT. One is accept the phenomenon as it is, then choose a direction in which direction the person should go. We will discuss each of these in some detail, and after that take an appropriate action. Let us discuss each of these. Acceptance, as I told, in the context of craving would mean make room for craving in one's life, not avoiding craving, not running away from craving. Live together with craving in the same room. Keep some space in your mind, in your psyche for cravings also. So what is the benefit? It helps the struggle involved in making the cravings go away. Usually what we advise, like especially in the initial stages of therapy, we usually suggest a lot of distraction techniques, and they are useful. They are very useful in the short term. We may ask the person whenever he is having a craving, he should you engage in some other activity like watch TV, listen to music, take bath, pray, call someone, do some gardening, do some farming, do some social work, whatever. These kind of activities, take bath or clean the room or arrange the cupboard. Lots of distraction activities we usually suggest. So these may help in the short term. That is, there is no doubt about that. But in the long term, whenever the person is having a craving and the person has to spend maybe 30 minutes, 45 minutes doing this kind of alternate activities, that basically leads to a lot of like wasted time. The time that the person was planning to do in maybe in more productive, more useful, more satisfying manners. So that is the problem with the distraction techniques when they are used in the long run. That is why we have a space for ACT when we are dealing with addictions. So it is here you are stopping to struggle with cravings. One metaphor is like you are getting out of the boxing ring. You have been fighting with the craving so far. Now you are deciding to stop fighting craving. You are not trying to run away from craving. Like you are just stopping fighting, and the craving will be there in the boxing ring. You will be outside it. That's all. So how to do that? One other technique is that we usually tell the person is avoidance. Like for example, we may tell the person to avoid parties, avoid functions where alcohol is served, avoid routes in which there are cigarette shops or bars or alcohol selling outlets and things like that. Again, they may be helpful in the short run. But in the long run, what happens? When the person has to avoid so many things, the person's world shrinks a lot, right? The person's freedom, the person's choices get restricted a lot. So this cartoon depicts that in a very excellent manner. One cannot like hide to greater beyond some extent. No, your head will come out of the other side. So that is what avoidance is not the answer to craving, especially in the long run. So accepting to live with craving is the better way. So what are the techniques of acceptance? You cannot simply tell the person, no, you accept. How to do that? There are 3-4 techniques, at least very simple techniques that you can describe to a patient even in like a busy OPD. Like many a time when especially psychiatrists are very wary of psychotherapies, people feel that no, I don't have that kind of time and things like that. But we here, especially in this lecture, I am not advocating any manualized, structured, time-taking, intensive sessions and all. We are just going to discuss some very practical, very simple tricks. Any patient, any person, even if the person is not having a lot of psychological sophistication, also can use, and also even a busy clinician can describe to a patient even in a very busy clinical setup. So cognitive diffusion is one of the techniques. What cognitive diffusion means is separating oneself from one's inner experiences. Like your thoughts, your feelings, your emotions, they are not you. One has to dissociate oneself from one's inner experiences. For example, there is a difference between I am sad and I feel sad. I feel sad means, okay, you recognize that you are having a feeling of sadness. While when you say I am sad, you are identifying with the sadness. You are equating that you as a whole, you as an entity, you as a person, as a whole is sad. It need not be so. You can learn to distinguish between you and your inner experiences. You can, as I said, it can be I feel sad. I am a person, and for the time being, I am feeling sad. That kind of dissociation has to develop from between you and your inner experiences. allows to see thoughts simply as thoughts, stripped of the importance the mind adds to them. Simply because a thought is coming to your mind does not mean that it represents you. It represents your values, your opinions, your perspectives, your choices. So one has to learn to dissociate between your oneself and one's thoughts or emotions. For example, in the context of craving, the person may feel that the patient may feel that I need a drink. So usually what happens, person may think that, okay, I have having a craving and it may not go away. Maybe it may worsen and I may have a panic attack, or I may have anxiety, or I may have some physical issues, or maybe the person may think that, okay, I will go and watch TV, or I will do something else so that I can get distracted. These are the kind of responses. Instead of that, when one is practicing ACT, one takes charge. One dissociates oneself from a thought like this. So the person can tell to the himself or herself, I am having the thought or feeling that I need a drink. So there's a difference. It is not I need a drink. There's a thought in my mind that I need a drink. So it becomes more easier to control that, to tackle that when you are dissociating yourself from that craving. Or one can say, thank you, mind, for letting me know that you need a drink. It is like, for example, your kid is coming and telling you that, okay, I need a very big LED TV. And you respond that, okay, thank you for letting me know that you need a big LED TV. That kind of response. So you are replying to mind. Okay, fine, you need a drink. Okay, fine, thanks for letting me know. That discussion ends. Then the mind will not in a powerful position to dissuade you into a drink anymore. Or another way is like reframing that thought as, okay, mind is trying to be bossy here. Mind is trying to boss me here. Okay, I am not going to allow that. I am going to take charge over my mind now. That kind of a perspective change, that kind of a reframing the patient can use. That is also going to be useful. This is another technique. Here what we do is like we teach the person one exercise. Here what like it is like similar to the mindfulness exercises. You tell the patient whenever the person is having a craving how to like do the cognitive diffusion. For that the person sits still, maybe with the hands and on a stool or chair, without crossing legs and feet, just with the feet flat on the ground. Then the person starts focusing, as in mindfulness, on the breathing, on the flow of the air. The person focuses on his or her inner experiences, deviating the taking back the attention from the exterior. Then the person has to imagine that he or she is sitting in a park where there is a stream through which loads of leaves are flowing. So they are watching the leaves flowing one by one. Then they can also pay attention to whatever thoughts are coming to their mind without judging the thoughts, be it a craving, be it a negative thought, be it a worrying thought, whatever thought is coming. Then the person can imagine that he or she is taking each thought and putting into one flowing leaf. One craving is coming, that is put into one leaf. One negative thought is coming, that is put into another leaf. So if the person trains in doing this, then it will be easy. When the real situation arises, the person can very fast like imagine. It is like the creative visualization technique that we usually use in stress management and all. The person can easily imagine, okay, this thought is going, it has come to my mind, now it is going away with the leaf. So that way, like it does not stay there to trouble, to haunt, to persuade the person to have a drink. This is another exercise, Sky exercise, that we will be demonstrating in the mock interview. So this website, this cravings and addictions book that from which I have taken most of the information, I will give a photo later. The website in the New Harbinger has lots of audios related to these exercises. These are instructions to the patient who is going to do these these kind of exercises. It is similar to what I just now told. It is in a more elaborate manner. In the link that I will be sharing, from that you can download all these audios also. And this is another exercise, like it is like comparing the craving to two boys in the car, that we will be demonstrating during the mock interview after the presentation. Now, another like approach the person has to be taught is about that the person is acting with willingness. What that means is like the person is making a choice. It is not thrust upon the person. The person is not a slave to this kind of choices. He is on with his own or her own will making a choice to see cravings for what they are, as we said, accepting them as thoughts, feelings, sensations, and memories. So that way the person does not feel that as a slave to our direction or something. the person has to know that by choose, because we will be discussing values later. So once the person accepts, he or she will be acting in accordance with the values which will be productive. So the person has to remind that even if I am choosing to ignore the craving, I am choosing to not have a drink or a smoke or an online game or whatever the craving is for, I am myself deciding, considering my values, my own long-term benefits. One comparison here is to going to work. Sorry. Going to work. For example, many of us don't like going to work, right? Every day the same routine. You have to get up in the morning, like in the sense that enjoy very much. The same routine, same aapka man kaise hai, this kind of routine. Though, but we do it day after day because we need the salary, we need that respect that comes with that, we need our career to advance, etc., etc. So it is like that only when one is tackling the craving in the context of ACT and one is doing some value-based actions. One is making a choice, though it is tough at the moment, but considering the long-term benefits and repercussions, one is making a very voluntary choice. This point has to be taught to the patient. Now, another exercise is making room for craving. Like it is similar to that leaves in the stream exercise itself. Here, what the person is taught is, again, focus on the breathing. Then image a craving forming. For example, the person can imagine a drink being offered by a friend, or he's or she is sitting in a bar, or somebody is offering a cigarette or something like that. When the person imagines such a situation, usually the craving will form. So then the person has to pay attention to the bodily changes associated with the craving. What happens to the breath, what happens to the skin, what happens to the muscle tone, what changes happen psychologically, all these kind of changes that happen with the craving, what happens to the pulse, all these the person has to intentionally notice. Then one can give a shape to that. This might need some imagination and some psychological sophistication, but this craving is given a shape like that of maybe a soft toy. So again, this is kind of a cognitive diffusion. One is separating the craving from one's remaining mind and body. So one can be trained to mentally hold and stroke the craving. Okay, craving, he is here, fine. Okay, you are here. So like as if caressing a soft toy, one can do that to a craving also, and communicate to the craving that, okay, now you have a home, you can stay here with me. So as a like an independent entity within your internal world, the craving can stay there, and you will be carrying on whatever you are intending to do. That way, one can make room for the craving imaginatively in one's psyche. Another technique that one can be taught is the present moment contact. It is similar to mindfulness only. So one has to focus attention to the current moment using one's all five senses. Again, one metaphor, because in ACT there are lots of metaphors. Even there is one book called Metaphors in ACT. Here the metaphor is that of driving. When you are driving, you cannot be focused too much on your rear view mirror or what all ways you crossed, right? You cannot keep thinking about how beautiful that valley was, how tough that road was, and all. Or you cannot be too focused on the future, in the sense that after the curve, what will be there, whether there will be any block, whether you will reach on time, and etc. You cannot be too focused on that. If you are focused too much on the way that you have crossed or the way you have to cross, then you are because of the inattention, you may end up with some accident. One has to pay attention to the here and now. That way only one can reach the destination. Like that, like even when one is having a craving also, there is a lot of role for the past and the future. Like there may be a lot of conditioning from the past. One may feel that, okay, if I have a drink now, I like I am causing this bar now, and whenever I used to cross, I used to go inside and have it, and that used to be good time. If I have a drink now, I will feel the kick of it, the pleasure of it, the euphoria and all. So all the memories, all the associations may come. So one has to ignore that. One should not allow the past to dictate what one is going to do now. So what one should do is staying mindful of one's surroundings, where one is, and learning to shift the attention away from the internal thoughts and feelings. Whatever memories, whatever associations, whatever desires are coming motivated by the past, one should ignore that. Just immediately focus on the surroundings using all your five senses. See what is around, smell what is around, touch what is around, So like that. That way one can focus on the present moment. That way one can learn to accept the craving. That helps build greater awareness and prevent, as I already told, prevent past experiences, memories, and conditioning from negatively affecting one's interactions in the here and now, motivating one to go and have a drink or a puff or things like that. So we told about acceptance. Acceptance means one is learning to live with the craving using techniques like a cognitive diffusion, present moment contact, making room for craving and all. I hope that part is clear. But simply by accepting and remaining there may be tough, because if you don't have anything else meaningful to do, again living with craving with a needle in a needle state may not be that practical. One may have the craving may get stronger and one may eventually yield to the craving. So one has to choose a direction. So each moment of craving is a choice moment in the context of ACT. One has to choose a direction. What direction I am going to take? Whether I am going to take the direction dictated by the craving, by to go and have a smoke or a drink or a match or something like that, or am I going to choose a different direction? That is the where the concept of values come. That is very important construct in ACT. Values means qualities one cherishes in oneself, others, and one's relationships. Like there will be people who value body a lot. They want to have good muscles, good look, and all. There will be people who value money. They may want to be rich. There will be people who wants fame. There will be people who wants to be well known, to be in, a political leader, and things like that. So these are values. Values, qualities that one feel that there is a good thing to have in oneself, others, and one's relationships. Examples of values are here: generosity, justice, perseverance, friendship, service, thankfulness, trust, truthfulness. There are lots of values. We have a longer list in the worksheets that I will be sharing with you later. So basically, values are deepest desires for what one wants to do and how one wants to be. This is a field where I would like to excel. I want a lot of friends. I want to be known as a singer. I want to make peace among people. I find happiness in that. So there will be maybe 2 or 3 values that each and every person gives a lot of importance to. Things that give one's life meaning and purpose. These are values. And they're intrinsically rewarding in the sense that one is not say playing football to get a lot of money or to get one's photo in the paper or something. Simply playing football is like enjoyable. That itself is rewarding for the person. Or maybe simply helping someone, helping a poor person, that itself is rewarding. Not like getting a name that, oh, he's a very good charity worker. That kind of fame is not there. The activity itself is intrinsically rewarding. That is what makes one activity, one quality a value. So how value helps is in the context of say ACT, be it to fight craving, be it to fight depression or low mood, is the way a good diet helps you fight diseases. When you take a healthy, nutritious, balanced diet, that helps improve your immunity, and that gives you a good defense against a whole lot of infections and other diseases. Like that, once you have a values-based life, then you will have like you will be able to escape a lot of psychological hardships, face a lot of psychological hardships like craving, anxiety, stress, depression, etc., etc. So again, to about deciding values and why values are important in the context of this choice moment I told. When one is facing craving, how to use the values. For example, persons may have values, but whether you should be choosing your values intentionally on your own accord, or whether you should be choosing values that are dictated by the environment, like dictated by your craving. Which one is better? Randomly choosing, because you can be in diverse situations where there is craving, and if you act in accordance with that, it may not be in accordance with your values. It will be simply randomly picking some values. There is in ACT, there is something called a game of life. Here what we do is, Alim, you are there, no? Alim?
Yes, sir.
Yeah,
Yes,
okay,
sir.
okay. So I am calling you here to help me out. You
Yes,
please
sir.
give me any 5 random numbers between 0 and 80.
5 numbers between
0 and 80. Any 5 numbers.
0 and 80. So
80.
suppose I say 7,
7,
15,
15,
26,
26,
33,
33.
yes,
Yes, then
71,
how much?
71.
7 months. Okay, so I got 5. So suppose we have 80 values, and like you have to choose 5 values that are important to you. Now, but now what we are doing is you are not given a full picture. You are just given the numbers, right? Now let us see what all values you are allowed to pick. 7 stands for, it's not visible to me. I think, just a minute. 7 stands for be poor. Wow. 15 stands for brave. 26 is hate where you live. 33 is criminal. A very bad day for you, Alim. 71 is steal. So that is what happens when one has to randomly pick values. There, see, in the list, there are a lot of other good values: respected, sexual, accomplished, freedom, effective, ambition, popular, and all. So the thing is, when one has to pick values, one has to be able to do that intentionally. One has to have it ready beforehand, not allowed to be randomly dictated by, like the way I allowed Alim now, randomly dictated by the moments of craving, by craving itself. So, like the person is asked, what are your values? And then you have to act accordingly when you are having the craving. So these are like, again, this is another exercise which we will be demonstrating also. Sorry. So here what we ask the patient is, we ask the patient, how important is this value to you? We have a list of values: inner harmony, personal growth, health, approval, and all. How important is this value to you? So maybe from this 0 to 10, patients may pick some of the values, rate some of the values, maybe 8, 9, and all. Then we ask the person, how much reward or meaning have you gotten from this in the past 2 weeks? Again, a rating of 0 to 10. Usually what happens is, even if somebody has chosen some values, but because of the addiction, because whenever the craving is there, the person is yielding to that and using the substance, or dealing or engaging in the addictive behavior, the person is not getting enough time or opportunity to give importance to these values. So how much meaning or reward have you gotten? Usually the rating comes 2, 3, 4, and all. Then the third column comes. How does dealing with your craving fit with this value? Then they may say, no, if I deal with my cravings properly, then I may be able to do better. I may be able to derive more meaning or reward from my value. So this exercise is, this is an important worksheet in SD that you can use to prove to the patient, to show to the patient that because you are not dealing with your cravings in an effective manner, you are not able to derive enough reward from the values that you cherish. Now, this is another exercise. This we will be demonstrating during the mock interview. Basically, how the person usually responds when the craving is there, and what would be a more appropriate response which is in line with the person's values, and all this we will be demonstrating. Sorry. So, basically, this committing to a values involves, it is not a static process. That is a dynamic, ongoing, in the moment process. Like, it is not that one has chosen a value and it is over. No. Whenever the person is having a craving, in that moment, the person has to make a decision. I have to make a choice. Whether I am going to yield to the craving and dictate what the craving is asking me to do, or whether I should. Dr. Manpreet, I think you are drawing again and again, please. Or whether I should be doing something in accordance with my value. So that is a dynamic process, ongoing process, in the moment process. Choosing, rechoosing the direction in which one moves. It is not a single time decision that the person has to make. Now, there may be value conflicts in the sense that any person may have more than one value, 3 values, 4 values, and all. So which value to choose? Whenever there is a craving, which of these values to choose? That is called value conflict. So if the patient raises this kind of a doubt, what you can tell them is, be flexible. Not always rigidly choose the same value over other. That is, again, kind of cognitive flexibility. Like if there are 3, 4 values, at one time you choose one activity based on one value, at the other time you choose another activity based on another value. So again, there is a difference between feelings and values. Like when we do activity scheduling for depression and all, we choose activities that are about mastery and about pleasure, right? It is always not pleasurable activities. We always also include activities that give a feeling of mastery. So acting in accordance with value is more like that. It is more of activities that give you a feeling of mastery than just activities that immediately make you happy or elated or hedonic kind of sensations like a drink or a smoke. So that is important. ACT is not focusing to give you pleasure immediately, but it is giving you more long-term feeling of mastery and having a direction in life. And also, even if the patient has decided to live the rest of the life or make the rest of the decisions whenever there is a choice moment in the direction of one's value, one should not insist that the others, especially the family, friends, etc., also follow that. It should be one's own decisions, one's own action. One should not expect others, because that may lead to, again, negative feelings and maybe even a lapse or relapse. So that was about acceptance. Then about choosing a direction that is in accordance with one's values. Then one has to take action. That is very simple. Take an action that is in accordance with one's values. So taking action helps develop, as I already told, that mastery thing. So a sense of meaning, purpose, and vitality. Whenever you are having a craving, you know what your values are, and you know what kind of activities will help you accomplish those values. You do that. That gives your life a sense of meaning, purpose, and vitality. That way, the struggle with the cravings will seem unimportant and unnecessary. You are not even bothered the craving is there or not, the drink is available, smoke is available, because you have a higher, better things in mind, better activities to do. So this is from one author. If I had to summarize ACT on a T-shirt, this is how I will do that. You embrace your demons and follow your heart. Like here, your demon is your craving. You are embracing your craving and you are following your heart and acting in accordance with your values. Though the craving is still there, you embrace it. You are not avoiding it. At the same time, you are acting in accordance with your values. So again, this also can help the patient. This is another exercise we'll be doing in the demonstrating in the mock interview also. So the person has certain values. For example, the person wants to pay a lot of attention to health. So what are some of the goals? The person may say, I want to lose maybe 5 kg in 1 year. So what could be some of the actions towards achieving that goal? So maybe dieting, doing some exercise, etc., etc. So what are the target dates for that? What are some of the obstacles that are anticipated in the process? And what are some of the strategies to overcome the obstacles? Let me show you an example from that book itself. For example, the value is friendship. So some of the goals in line with that value would be develop new relationships with others. So what would be some of the committed actions to achieve this goal in line with the value? Go to a yoga class this week and talk with someone new so that I can have some new relationship, a new friendship. So what is the target date? Date is there. So what are some of the obstacles that may arise if one plans it this way? Maybe a concerns over the new person not wanting to talk to me. I may be wanting to befriend a person, the person may not want to talk to me. So what is the strategy to overcome the obstacle? Use acceptance and mindfulness to acknowledge my concern and commit to introducing myself anyway. So even if the person does not mind, I will accept that. I will use mindfulness techniques. I will move on. But I will take the first step. Like that, the patient is given a kind of a roadmap. What are the values? What are the goals? How to achieve that? How to overcome the obstacles? And it is also important to note that whether the goals are achieved or not, it is not relevant. What is important is fighting the craving and working in the direction of one's values, doing some activities intended to that may help in achieving reaching one's goals, one's values. But even if one does not achieve that goal, that is absolutely fine, because if the focus is more on the goal, what happens if the goal is not achieved? Again, there may be stress, anxiety, depression, and then there may be a lapse and relapse. We do not want that to happen. Achievement is wonderful, but perseverance is at the heart of commitment. One has to persevere with the activities related to the goals, related to the value. In a single slide, I would like to summarize the evidence base of ACT. This is not one of the prominent journals, but this is the only recent review article that I was able to find from Journal of Clinical and Medical Research 2020 article. So what the authors found was that they had 22 studies of ACT in SUD. And they found that most of the studies found there is either a reduction in the substance use or even total discontinuation. So ACT has at least some evidence base. So this is the one of the books from which these worksheets are from that book only. I will share the link where you can get the worksheets also. A very useful book. And another one is the wisdom to know the difference. Both these books are actually meant for patients. So what that means is they have very simple language, very simple techniques. Anybody can easily understand and follow them. Not a lot of theory and evidence base and p-values and things like that. So that's it. I will share that link in the chat box. Then we will have the mock interview. Dr. Abin, you are there, I suppose.
Can he raise his hand so that we can identify him?
Abin, please raise your hand. I am sharing the link to the files in the chat box. Yes. Yes, Abin, please unmute.
Sir. Sir, am I audible?
Yes, yes. Thank you. So welcome. So here Abin is he's a first year psychiatry PG student in Trivandrum Medical College. Thanks Abin for deciding to help me. So here he will be acting as a person called Manoj, who is a businessman who recently had a relapse. So we will start the interview. Once as we proceed, I will move to relevant slides also. So Manoj, I spoke to your father and your wife. They told me that after your discharge for 2-3 months, you were remaining abstinent, you were not drinking, you were focusing a lot on your work and all. But I think recently they told me that you attended some birthday party, and after that you have been drinking for the past about a week. What do you have to tell about this series of incidents?
Yes, sir. I was maintaining my abstinence for the past 3 to 4 months, but after 3 to 4, after this much duration, I became a little bit of confidence that even if I do a little bit drinking, or for one day, even if I do it for one day, I will be able to control my cravings. Like that, I became confident, and during the birthday party, the memories of previous highs and all came to my mind, and I thought maybe for one occasion I can just let it go, let the absence break, and basically what happened was I started drinking more frequently.
Okay.
I couldn't stick to my plans.
Okay, so you have been managing your craving, but that day you felt that you have some experience by now in managing craving. So maybe even if you have one drink, you will be able to manage your cravings from the next day. But that did not happen. Okay, so how did you manage your cravings in the past about 3 months before this party?
In the past, sir, I used to divert my feelings. Whenever the craving comes to my mind, I try to avoid it by diverting, doing some listening to music, doing some exercises, or like things, different activities I used to try for diverting my mind. That is what I used to use previously.
Okay, but that day in that birthday party, you did not try any of this.
Sir, what I think is that in long term it is not practical because every time I don't have the mood to do such a thing, I in my busy life I feel a lot of unproductive time is being produced due to these extra activities or diverted activities, which I don't actually like, or I'm not always motivated to do them.
Okay, you are not planning to watch TV, or you are not planning to listen to music and all, but because of the craving, you have to spend time for that.
Yes.
So anyway, your time is lost. That is what you mean.
Yes, sir. In my busy life, time is completely lost, and also I could not keep that cycle continuing because I was not that much interested also.
Okay. So are you interested in learning another technique where there like this kind of waste of time will not be there, and you can use the time effectively and also face your cravings?
Yes, sir. Definitely. I want to listen to.
So there is a technique called acceptance and commitment therapy. Here, basically, what we do is one has to accept. Like when a craving is there, you need not run away from that. You can let the craving exist in your mind. If the craving is not going to harm you, let it be there. The way you are having your shirt there, or when you are having your phone with you, like that, the craving can coexist with you, and along with that, you can do some other activities. How to do that? I can teach you one or two techniques to do that. For example, one way you can learn to coexist with your craving is one opinion that many experts have is that your mind is like the sky. Under the sky, many things can happen. There can be a thunderstorm, there can be intense sunshine, there can be heavy rains and all. But after that, again, these are all temporary. After that, again, the sky becomes clear. Right?
Yes, sir.
Like that,
Yes,
in
sir.
your mind also, cravings may come and go. Depressive feelings may come and go. Anxiety may come and go. Let them come and go. They are not going to touch you. They are not going to change you. They are like the weather, and you can remain independent of them like the sky. Even if you feel craving for some time, and that will pass away after some time, it will not persist for a lot of time, like hunger or thirst or something. It will go away. So you can just let it be there and let it go, and you can remain detached from that like the sky. That is one thing. Another way you can look at it is suppose you are going somewhere in a car. You are driving the car. You have a destination. Maybe you have a meeting or a marriage or something to attend. While in your backseat there are two of your sons, and they are repeatedly asking you to go elsewhere. They want to go to a park, or they want to go to a mall or somewhere, but you know where you want to go. So you are not arguing with them. You are not obeying them. You are not heeding to their request. Let them keep making the request, but you know where you want to go. Like that also you can do when you are having the craving. For example, let the craving be there, like these two boys who are nagging. But along with the nagging, you can be focused on your destination, and you can move ahead. Could you tell me two or three values that you cherish a lot? For example, there are certain qualities that people give a lot of importance to. Some people value friendships a lot. They want to have a lot of friendships. They like having a lot of friends. There will be some people who are interested in cricket. They want to watch a lot of cricket. They want to know which team who. They want to know about all players. They want to be able to predict the match results, things like that. They want to be experts in cricket. There are people who want to do a lot of charity work, and they derive a lot of pleasure from helping people, help those who are poor, those who are sick, etc., etc. So are there any values that you give a lot of importance, that are important to you in your personal life?
I give a lot of respect to being financially successful. I like it that I want being financially successful. I respect a lot. I want myself to be financially successful. That is one thing that I want for myself. And also, I want to look after my body. I want to be healthy with respect to my body, and also build some body, also build some mass. That is these two things I carry forward. So I look upon them with a lot of respect.
Okay. So financial success, then physical health.
Physical health.
Okay. I think you can have a look at this chart. So out of in a scale of 0 to 10, how important is this value of financial success for you?
Financial success, sir, it's very much important for me. I will rate it like 9. I will rate it is so 9. I will rate it, sir.
9 out of 10. Okay.
Yes,
okay, good. Okay. Now the next question is, in the past 1 week, like you have been drinking since that birthday party, no? In the past 1 week, how much you have been, how much reward or meaning you have been able to get from financial success, from activities related to this goal of having a financial success, out of 10?
Past 1 week, I was not able to concentrate on those things, sir. I know that I have to work a lot for that. I have to understand how to manage my personal finances and all. But for past 1 week, I did not do anything much for that.
So what score you would give out of a 10?
Maybe not 0, sir. Almost 0 it is.
0. Okay. So that is 9 out of 10 important to you, but in the past 1 week, you have been able to derive only 0 reward from that. So how, if you deal with your craving very effectively, like in that birthday party, suppose you were able to manage your craving, how helpful would that have been in relation to your the importance you give to your financial success part?
if I was able to manage the cravings at that time, I could have invested more time. I could have.
How important is that out of 0 to 10, like dealing with craving effectively? Because in the past 1 week it is 0 now. So how important is that you deal with your craving effectively so that you are able to focus on your financial success part?
It is fully important for me, sir. I guess it is 10 out of 10 on 10.
10 out of 10. Okay, so you understand that financial success is one value that you give a lot of importance to, but because you were not able to deal with your craving properly, you like were not able to give it the sufficient time or importance, and it is very important to you, right?
Yes, sir. Yes, sir.
Okay. Now, usually, like you had a thought, like in that birthday party, you had a thought that I will maybe have yield to the craving today, I will have a drink today, and maybe from tomorrow I will control, right?
Yes,
And
sir.
your response was that you had a drink, but after that you continued drinking.
Sir, after that, I
Okay.
continued drinking.
But what other activity you could have done, like in relation to your financial success part? Could you have done anything when you are having that craving? Like earlier you said, no, you don't want to waste time watching TV, listening to music and things like that. But
Yes,
to
sir.
do something productive, to do something in line with your value of financial success, what you could have done it then and there when you were having that craving? Is there anything?
Actually, I could have focused more on my, I could have focused on my diet. I could have met all my friends, but maybe I could have left home early so that I could stick on to my routine for looking into the different mutual funds or other options, so that I can learn about the growth and interest of different investments, so that I can make a more financial literacy. All that I was actually focusing for the past 2 months, but I lost it. So maybe I could have gone home earlier that day after meeting my friends and after having maybe a smart time, like good enough time. After that, I could have left or to home so that I could focus more on these things that I'm trying to learn as part of my.
Okay, I got it. So instead of drinking, you could have spent the time researching like about various mutual funds, etc., so that you can make more money and reach your financial goals. Okay.
Yes, sir.
So which of these responses are better? Like it is obvious, like in respect to your values, the drinking or going home and doing research about mutual funds. Which one would have helped your values better?
Going home at that time could have
Yes,
helped
the
me.
second one. Okay, that's good. Okay. So, like for example, any goals you have in relation to your this financial success part? Any specific goal? Like that is not a very concrete thing, Like I want to achieve this by this date, something like that.
Sir, maybe after 5 years, I want to buy a new house. Buy a new house. I wanted to do that.
You want to buy
what-
a new house.
Yes.
Okay.
Yes, sir.
So, what is the first step that you have to do to achieve that?
I was actually planning to expand my business. Maybe I wanted to open a new showroom or at a new place like that.
Okay. You will expand your business so that your profits increase and you can get a better new house. Okay.
Yes, sir.
So by when you are planning to start a new showroom?
Maybe by June 2024. That is what I was planning.
What would be the first step for that?
Procuring the permissions and etc. will be the first.
You have already found the plot, the building and all.
Yes, sir.
You have to get the necessary permissions.
Permissions.
So by when you are trying to get that?
Maybe next month itself, sir.
Okay. So any obstacles that you anticipate when you are trying to get the permissions?
Definitely, sir. Some of them will be there. It is due to the government lag and all. I may not get the permissions. Like that, things can happen. I expect them to happen.
So you have any plans, like how you are going to tackle such a situation if they don't give you the permission within the time and all? How you are going to face the issue?
I'll try to connect with some of my friends, sir. For legal support or for some recommendations and all.
Okay. You have some political connections, and through them you will deal with that. Okay. Good. Thank you. So that's it. Basically, thank you, Abhin. So basically, this is it. When the person has, we have helped the patient identify the values. helped the person identify some behaviors, some goals related to those values, and help the person create a plan, a roadmap, how to achieve the goals related to those values with the dates and what are the obstacles and what are the solutions to that and all. Then the person will be preoccupied with these. Even if the craving is there, the person won't be bothered. That is the thing. The person will be able to do activities related to reaching these goals, irrespective of the craving being present. So already the link I have shared with all of you. Thank you.
Thank you so much, sir, for a wonderful presentation, demo, question answer. I think it was a very complete sort of presentation for everyone who is trying to work in this field. Thank you so much, sir. Over to Dr. Raghav for his opening remarks. Then we can take some questions.
Thank you, Abhin, once again. Okay.
Sir, very well presented. The topic, and especially the second part of the presentation where you took it to a practical level, because many times we read a lot of therapies, difficult to make the differentiation where which therapy would be more useful and how to apply that therapy. So it was almost like a workbook approach to acceptance and commitment therapy. So I'm thankful to you for that. And now we can take up the questions, as Dr. Aleem said on.
Yes, sir. Shaul, sir, first of all, we start from general things. So in addiction treatment, there are medications, there are already established therapies like motivational enhancement and all those CBT techniques are there. So what is the place of ACT in a general perspective of addiction treatment?
Especially when the person has repeated relapses, especially when the person has difficulty controlling craving. When you are doing ACT and all, it is assumed that the person is in the preparation or action phase, at least initially. If somebody who is in pre-contemplation or contemplation, then you have to focus with the motivation interview. Other than that, if you explain when the person is absolutely not prepared and you are giving them these techniques, they are not going to listen to that. Once the person is prepared, or maybe or in the at least in the preparation stage, out of the contemplation phase, only then you can teach them, especially when they have specific difficulty tackling cravings. There is the role of where the role of ACT comes.
Okay. And so there was a question in the chat box regarding the next thing. Who is a good candidate? Who is not a good candidate for ACT?
A good candidate, as I already told, like as in the mock interview, it was there now. Like especially those who want to be, they have decided to stop drinking or smoking, and they want to lead a productive life, and they don't want to waste a lot of time with the distraction strategies. Like, there are lots of people who manage with other activities like watching TV, listening to music, and distraction. Many people who do that, and for them, if it is not a lost time, if it is absolutely okay, then maybe they can survive with that only. For them this may not be relevant, but those who want to be to both to tackle the cravings, remain sober, and have a very productive, efficient life that generates results for their values, for them I think yes, it is more relevant.
So in general, is it better than other therapies? It is equivalent, or it is case to case different?
No, it is not. I don't think there is any comparison as like, because it is not also like they are not mutually exclusive. Each has its own space and indications. Motivation interviewing, it is clear. The person is in pre-contemplation or contemplation. The person is saying that I don't have a problem or I don't want your treatment. Then you go for motivation interviewing. CBT is for those patients who, like again, who are repeatedly relapsing because of certain cognitive distortions. Like, for example, in this particular case, the patient was saying that, I can have today and tomorrow I will stop. Such kind of thoughts you can tackle through CBT also. Like, I have remained abstinent for 3 months. Now it is okay if I have a drink. That is called entitlement in CBT perspective. So for that kind of cognitive distortions, you can use the usual CBT techniques and like prove to them that these are baseless. There are like more valid alternative thoughts. That kind of CBT also you can use in such situations. but especially with relation to craving, craving when it is very prominent in the person's life, and that is again repeatedly leading to relapses. For those kind of patients, this may be better.
Dr. Raghav wants to add something, please, sir.
Yeah, and sir, what I can also understand from your presentation is that these therapies can be useful sequentially also in the same person. Like before the treatment starts, he may be more of a candidate for a brief intervention or a motivational enhancement technique. And then later on in the maintenance stages, or where we have to prevent relapses, which is more of a focus, then this could be the more favored approach. I think that is also what you mean.
Thank you. Yeah.
And sir, one thing I would like to ask also, sir, like in the 12-step approaches, where there is also a different kind of acceptance that is being generated. So this is more out of mindfulness, but their focused acceptance mainly about your addictive behavior and owning up to it, and then embarking on the journey to make amends and changes. So where both these things, like can a person be attending 12-step groups regularly as well as continuing with acceptance and commitment therapy?
There's a lot of overlap actually. There's a lot of overlap because even in the A prior, this part is there now. To change things I can, and to be content with things I cannot change, and to know the difference between the two. That is, I think, the one of the important parts of the A prayer. And this book I was talking about, in this one there is a separate boxes where each and every technique, how that is related to A. That the others are separate, like each and every step of the 12-step program, how the techniques of ACT relate to various steps in the 12-step process. So it is already given in very much detail there. They are not contradictory to each other. There is a lot of overlap between the approaches actually.
Okay, sir.
And the basically the name, the wisdom to know the difference, that is from the A prayer only.
Right, sir.
The wisdom to know the difference between the things I can change and the things I cannot change. That is directly taken from the A prayer. The books are available in Amazon.
Amrit, any comment from you?
Yeah, I think it was wonderfully presented. I think, sir, I just want to ask you one or two practical questions. So, what is the time limit? How much time should you spend on a patient per session, and how many sessions would be good enough? If you really look at our busy practice, we are not very psychologically oriented also. So,
No, you saw the mock interview, no? Maybe that took about
yes,
maybe
sir.
10, 15 minutes, not more than that.
15 minutes. 15
And
minutes.
along
15
with that,
minutes.
if you do that, so that you can do in one session. In another session, you can teach about that maybe stream leaves in the stream exercise. In another one, you can teach another that sky exercise maybe in greater detail, and also not a lot of time. Maybe at the most everything combined 1 hour, maybe 4 sessions
1 hour,
of
maybe
15
4 to
minutes
5
each.
sessions.
Yeah.
So compared to other therapies, what is the success rate in your clinical practice?
No, that is what I told. No, it is there. Not, it is not like a fluoxetine versus venlafaxine. Not that kind of thing. Like Dr. Raghav was saying, in the same patient, you may have to use motivational interviewing in one phase, then CBT in another phase, then ACT in another phase, depending on the indications, depending on the kind of challenges the patient is facing now.
So patient has to be motivated to stay with you. If you can try out different modalities of therapy, we need to.
Yeah.
Okay. So there was a question in the chat box. What about ACT when there is dual diagnosis?
Dual diagnosis, it may not be that easy, especially if the dual diagnosis is, say, psychosis or something like that. But ACT is actually, even before addiction, it was for conditions like depression, anxiety, and all. So maybe if that is the comorbid condition, then ACT for those conditions also may help. The way one is accepting craving, that same way one can teach the patient to accept anxiety, accept panic, accept depressive cognition and all. That diffusion and all, one can teach for them. So comorbid anxiety and depression, ACT may be very good. Schizophrenia and all, I am not very sure, especially how receptive our patients will be to techniques like this, especially when they are having florid symptoms or maybe negative symptoms or cognitive deficits and all. Otherwise, it should be okay.
Yes, sir. In a mock interview, you said the patient was having anxiety or craving and you said to let go and move to detach it and move to something else. Now, many times patients say, I cannot let go of anxiety. Anxiety is so severe, or craving is so severe, or the feeling is so severe that I cannot get over it. So it becomes a sort of roadblock. I become helpless at that time. So how to help the patient in that?
No, the craving, even if it is like even anxiety is there, it is not going to harm somebody. What I tell the patient is, unless you have, say, coronary artery disease or something, anxiety is not going to harm you in any way. People pay to feel anxious. People go to watch horror movies. People go that bungee jumping and all those rides and all. They pay to feel anxious, right? So you're getting anxiety for free. So you like take it and like let it go. Like you wait till it is over. Even this kind of reframing can help. And craving also. Craving, what I tell is like I told in my presentation also. Like people usually feel that like when I am feeling hungry, till I eat something, the hunger will keep on increasing. Taste also is like that. But craving is not like that. Even if you don't smoke or no, don't drink, the craving will go away after some time. It is like the way we do the ERP for OCD. Anxiety may increase initially, but it will go away the first time. The next time it will be less, like it may be briefer and less intense. Next time it will be a further reduction in the intensity and duration. Like that will happen for craving also. With time, the intensity and duration will dissipate. So especially in the initial stages, as I told, the distraction techniques like watching TV or music or phone calls and food eating, something like all this can help. But after that, once the intensity decreases, one can start engaging in activities in line with one's values.
Okay. Amrit, I think we have covered most of the questions. Dr. Raghav, we have covered most of the questions, I think. All of the questions.
Yes.
Sir, where to buy these books? Where to
Yes,
buy
sir.
these books that you are showing?
I already told, like in Amazon, both are available. Both the books are available in Amazon. And the worksheets and all, worksheets, audios and all are there in that link that I shared.
The links are, the people are asking for the link once more. So if you can.
Link, I think you can paste or I can also paste.
I have pasted it.
Okay.
So, sir, basically what by ACT means, first we accept that there is a situation. Suppose there is craving, there is anxiety, or suppose there is a person with sort of, if you say there is a cancer in a person, cancer relapse in a person. So you have to accept that situation. So
Yes.
acceptance means what? This is the fact of life. We are stuck up here. We cannot change the situation. That is the situation is final. That is the, or something else. How do we accept it basically?
That's what I told. No, accept the things that one cannot change and commit to change things one can. And if you add the A, also one should know which is which. So like craving, the emergence of cravings will be there. That one cannot change, but one can commit to change how one responds to cravings.
Okay.
The emergence of anxiety one cannot change, but how one responds to anxiety, how one deals with the situation, that one can change. That is acceptance and commitment to change.
So suppose I say that Amrit is an idiot, I accept it, and then if I can bring some change in him.
Then you are an idiot. If you try to bring change in an idiot, you are an idiot. Bigger idiot.
Sorry for the interruption. So basically you want to change something and then you try to change it. You use alternate ways, you use your you develop insight into those behavior. You try to have alternate paths, you have to try to have alternate menu sort of thing.
Activities based on values, yeah.
Yeah. And the process was the interview you displayed and the work material that you sent. So I think this summarizes the thing. Or anything else is left out?
I think Sir has been speaking non-stop. You need to.
Yeah. Thank you.
So
Raghav, your final comments, and then we move to Tufan sir, and then ending by Amrit.
Right, sir. Sir, one thing that I would like to add is that acceptance and commitment to change, both the words, because many a times what derives from Oriental cultures like ours is acceptance is taken as some kind of a passivity, actually, that you just accept how you are and move on in life and don't change. So acceptance and then commitment to change. both are required, because once you accept yourself, then you are at peace, and from there you can start. So I think that is one last thing that I wanted to add. And I must say, Shahul sir, it was very well presented, and very fluently you kept us riveted for last 1 hour. So there was no time to get distracted, no need for distractions actually.
Thank you.
And the audience has been participating. The chat box was buzzing all through, and all the seniors here have been very receptive to what you have said. And I have read in the chat box also that some of the seniors have been very appreciative, along with the other participants. So I think this will open up to the window about ACT as one of the options for addiction treatment. And as I had also mentioned in the beginning, this is actually very relevant to our culture also. And here, one of the major demands that the person with addiction changes from his core can be addressed. So now I will pass on to Tofan Pati sir for his comment about the presentation.
Thank you, everybody. I am having a bad throat, I told in the beginning, but I cannot resist from complimenting Dr. Shahul Amin for this excellent presentation, as well as Chairperson Dr. Shah for very nice interpretations and nice inputs. Thanks, both of you. And what you can suggest in some time, can have a workshop for art along with fact, not necessarily focused on addiction, because they can be used otherwise also. Thank you, Dr. Saha.
Thank you, Amrit. Amrit, unmute, please.
Thank you, sir.
So from the core of our heart, we would like to thank my dear senior Dr. Shahul. He volunteered he has come back from ANSIPS, and within 3 days he's ready to speak. And on a difficult topic. It is not very easy. It is not something which we have studied in medical science, maybe. And the way he demonstrated it, the way he gave examples, the way he is sharing his PowerPoint, the way he's sharing his text. It goes a long way. He's not just trying to show his knowledge; he's trying to spread it, and that's what we require from our teachers at the end of the day. It is not his property; it is our property, and that's Shahul sir. Thank you so much. A lot of times we have people asking us for PowerPoints, and unfortunately, Dr. Lalit could not join us, but Dr. Raghav has been excellent. As a chairperson he's been giving his inputs. He's been trying to explain certain things, and the whole presentation went on very well. We had more than 280, 290, logins with a peak of 230, and that's really great. Thank you so much. Thank you. And I think Thursday Musings has given us, me and Aleem and Tufan sir, something to be proud of. And today we are in the national office bearers, both of us. I think we'll carry on the academic torch further and further. So we were thinking maybe kab band karenge, but then we think no, let's even if it's tough every week, but we'll do it. So we also want inputs from people to get us good speakers, good topics. We need those things. Sometimes we are also becoming stagnant, and we start a new era with this. So thank you so much. Thank you, Odisha Psychiatric Society, and thank you, Torrent, for always being behind us, helping us. Good night. Take care. Stop drinking. Accept. Don't look too much into the future. Don't look too much into the back. Focus on now, then, and mindfulness, and we are all there. Thank you. Good night. Good night, everybody.
Thanks, everybody.
Thank
Good
you so
night.
much.
Thank you, Shahul sir. Thank you, Dr. Raghav, Tufan
Thank
sir,
you so
everyone.
much, sir. Thank you.
Good night. Thanks, everyone. Thank you.
Thank you.
Good
Thank
night,
you.
sir.
Ending the meeting.
Thank you.